Normally ladies they're doing pregnancy tests from about 6-8 weeks and we'd like to meet them between the 8 and 10 week mark ideally. When they find out they're pregnant, we'd like them to contact the GPs because there's a little information pack that explains about our role, a little congratulations together with a screening booklet. The screening booklet contains information on the bloods that we're going to take and about screening to find out what the risk factors are with having a baby with a disability.
Hi.
How are you doing today?
Good, thanks.
So that's our first point of call and our first introduction with the families so that we get to know them. During that appointment, it's one of the longest appointments that we have with the women. They can take up to 90 minutes and during that appointment we like to get a full medical history of both of their families on both sides, from the mum and the dad, and the purpose of that is so that we can direct the right type of care for that woman, whether she might end up being what we call low risk pregnancy, so that would be midwifery led care, so they would only ever see a midwife throughout their antenatal appointments, or whether we would do something called shared care where we would refer them to a consultant depending on their needs and condition, and then we would see them in between the consultant appointments.
We obviously see a lot more women with diabetes who are becoming pregnant because they've had really good preconception care, and then you've got women who've got like long-term conditions like Crohn's and heart problems who ordinarily you wouldn't see becoming pregnant, and then you've got the likes of women who we've got IVF and stuff like that, so fertility treatments are moving forward, and so we do have a lot of midwife-led care, but then you've got consultant-led care and all the ones that are in between as well, and we work together with the consultants to try and facilitate normality for those women.
There's the classic over the shoulder. Yeah, we don't need to be whacking. It's just a gentle rub, very gently, yeah. And then the other one is just over the knee and supporting the head again, and again a gentle rub.
And I bring up the antenatal classes right at the beginning. It's always offered at the booking appointment, and I always give them a piece of paper with the list of options, including actually aquanatal classes, so exercise as well. I always then remind them it's 16 weeks when they come in for their next appointment, shall we phone up and book that? And 9 times out of 10 I'll do it while we're in the room, and I'll ring the office and book the lady on.
We'll talk about labour, we'll talk about preparing for the birth of your baby, we'll talk about the impact on relationships, what partners can do to help the ladies, you know, during the pregnancy and when they're in labour. We talk about pain relief options that are available, birthing options. We talk about a bit about life with a newborn baby as well, and changing nappies and bathing babies, cord care, feeding babies, bonding. And we go through all of that at the parent craft sessions. So then when we go to see them to do the birth plan, hopefully they've already got a lot of that information.
So from 28 weeks when you see us, we'll actually start measuring your bump. We'll measure the symphysis fundal height. Yeah.
Have you had any thoughts about where you would like to have your baby? What hospital would you like to have your baby in? Basically the options are you can choose to have your baby in a hospital, you can decide which hospital you'd like that to be, or you may choose to have your baby at home if you're a low risk pregnancy. And birth plan's really about things that are going to make it special for that particular couple. So it might be they don't know the sex of the baby. How do they want to find that out? Do they want to look for themselves? Does the lady want the partner to tell her, or do they want the midwife to tell them? Does the partner want to cut the cord? So, and it's things like that kind of make it personalised and special to them, because that's our role really, is to try and make it a positive experience for them. They have their first scan around about the 12-week mark. They then see their community midwife at 16 weeks. Their next scan, which is called the anomaly scan, that takes place between about 18 and 20 weeks. That scan looks really in-depth at the baby, and we are checking to make sure that your baby's healthy. It's also the scan where if people want to know the sex of their baby, that is the scan to ask at, and if the baby cooperates, by all means the sonographer will let you know. If you're under the care of a consultant, you'll normally see a consultant after that scan. And then depending on what pathway you're following, depending on what kind of medical history or medical conditions you've got, whether you need to be under a consultant or whether you need to just see the midwife, that kind of dictates kind of how your appointments run from then onwards. But as a rule, we kind of see about from 25 weeks onwards, about every 3 weeks up to 36 weeks, then we see it every 2 weeks, and then we see it 39 weeks, 40 weeks and 41 weeks.
So how are you feeling in yourself?
We have a visiting schedule, so we always come and see mums on the first day that they come home. And regardless whether that's sort of Christmas Day, Easter, whatever, we're a 365-day service, so we always come and see mums on weekends as well. We always do a day 2 colour check to rule out jaundice. Our MCAs visit all ladies that are breastfeeding on day 3, and we found that ladies that had input from our maternity care assistants on day 3, the weight losses and things have been well within what we'd want them to be. We haven't had any large weight losses.
I'm sorry, sweetie. You're all right, I know.
And then day 5, where we come and do the newborn blood spot screening and we weigh baby. And then really it's about needs after that. So if a lady needs to see us again the next day, we will. They have our contact numbers and we'll carry on seeing ladies for as long as we need.
Any concerns at any point about anything, they can ring up and we're happy to see people whenever, even if it's just to provide some reassurance or answer questions.